Hello all, good morning. In this contest, we are going to discuss the surface markers of hepatitis B infection. As an introduction, hepatitis viruses, these are taxonomically different viruses. These are heterogeneous group of viruses and are hepatotrophic. That is, this hepatitis viruses causes acute inflammation of liver. Hepatitis virus include hepatitis A virus, B, C, D, E, and F. Hepatitis A viruses causes infectious hepatitis. Hepatitis B virus causes serum hepatitis. Hepatitis C virus causes post-transfusion hepatitis, and hepatitis E virus causes enterically transmitted non-A, non-B hepatitis. As we are going to discuss the surface markers of hepatitis B virus, we are discussing this hepatitis B virus in detail. Hepatitis B virus comes under the family Hepatnaviridae. These are the only DNA virus in hepatitis family. Hepatitis B viruses are double-shelled particles. Their outer envelope is made of lipid, proteins, and carbohydrate. Morphologically, this hepatitis B viruses exist as spherical forms, tubular or filamentous forms, complete form, or day particles. What are the antigens present in this hepatitis B virus? Otherwise, viral antigens. The first antigen is hepatitis B surface antigen, which is denoted as HBsAg. The next antigen is hepatitis B core antigen, which is denoted as HBcAg. Next is hepatitis B precore antigen, which is denoted as HBeAg. Also, this virus has an inner icosahedral nucleocapsid core, and the genome. This genome is divided into 8 genotypes like A, B, C, D, and in that A and D are more prevalent in India. And the genome is a circular double-stranded DNA and has a DNA-dependent DNA polymerase. Two subvirion morphological forms are there, that are spherical particles and elongated particles. Both of these structures composed of HBs antigen, that is surface antigen, and have no HBc antigen, that is core antigen. So this is the structure showing hepatitis B virus. Surface antigen is there, core antigen is there, precore antigen is there, and an inner nucleocapsid core which contains double-stranded DNA and DNA-dependent DNA polymerase. Next, moving on to the pathogenesis of this hepatitis B infection, there are three modes of transmission mainly. The most important one is parenteral transmission. Parenteral transmission is through blood, body fluids, or through accidental inoculation during surgical or dental procedures, or percutaneous inoculation by shared rhesus. Second mode of transmission is perinatal, which can be transmitted from carrier mothers to babies. Placental transmission is there, and breastfeeding transmission is also there in hepatitis B infection. The third transmission is sexual transmission. Hepatitis B viruses present in all body fluids, semen, and vaginal secretions can be transmitted by sexual contact. Particularly, male homosexuals are at high risk. Direct skin contact with open skin lesions may also transmit the virus. So, we are mainly discussing the surface markers of hepatitis B antigen. Before that, we had discussed what are the types of hepatitis viruses Later, we had discussed hepatitis B virus in detail, their morphology, what are the viral antigens present, and the structure of hepatitis B virus. And as we had discussed the pathogenesis, there are three modes of transmission, mainly parenteral, perinatal, and sexual transmission. Direct skin contact with open lesions may also transmit the virus. So this is the figure showing the mode of transmission. So next is a laboratory diagnosis of this hepatitis B infection. So laboratory diagnosis includes the detection of hepatitis B antigen and antibodies. These are mainly detected by sensitive and specific tests like ELISA and RIA. So in the laboratory diagnosis, we are giving more specialty or more specification to the detection of viral markers. This is very important in the laboratory diagnosis of hepatitis B infection. So moving on the detection of viral markers, the first marker is hepatitis B surface antigen. Hepatitis B surface antigen is the first marker to be elevated following infection. This marker appears within 1 to 2 weeks. Presence of this hepatitis B surface antigen indicates onset of infectivity. This hepatitis B surface antigen remains elevated in the entire duration of hepatitis, becomes undetectable after 1 to 2 months after the onset of jaundice. This hepatitis B surface antigen is used as an epidemiological marker of hepatitis B infection. So the first viral marker detected during hepatitis B infection is HBs antigen, otherwise called hepatitis B surface antigen. Moving on to the next marker, that is hepatitis B E antigen, that is hepatitis B pre-core antigen and hepatitis B virus DNA. These markers appear concurrently with or shortly after the appearance of HBs antigen in serum. They are the markers of active viral replication, high viral infectivity, and their presence indicates that the virus is actively multiplying, which could be acute active hepatitis or chronic active hepatitis. For these markers are present in a carrier in whom hepatitis B virus is actively multiplying and highly infectious, and these carriers are called super carriers. So the second marker we are detecting during this hepatitis B infection is hepatitis B pre-core antigen, which is denoted as HBe antigen, and hepatitis B virus DNA. Next marker is hepatitis B core antigen, or hepatitis B core antigen is denoted as HBc antigen. This marker is not demonstrable in circulation since enclosed within coat of this hepatitis B surface antigen. So this hepatitis B core antigen is enclosed within the coat of hepatitis B surface antigen so that it is not demonstrable in circulation. Next, we are going to detect the antibody markers, and the first antibody marker is anti-HBc IgM. This antibody marker appears in serum in a week or two after the appearance of HBs antigen. Its presence indicates acute hepatitis B infection. So, anti-HBc IgM is therefore the earliest antibody marker to be seen in blood. So, the earliest antibody marker to be seen in blood is anti-HBc IgM. Next antibody marker is anti-HBc IgG. This antibody marker appears in late acute stage and remains positive during chronic stage, carrier state, and recovery state. This marker is also used as an epidemiological marker of hepatitis B infection, as this markers appears in late acute stage, positive during chronic stage, carrier state, and recovery state. Next marker is anti-HBE. This antibody marker, which will appear after the clearance of HBe antigen, and their presence signifies diminished viral replication and decreased infectivity. And the last antibody marker is anti-HBs. This antibody marker appears after the clearance of HBs antigen. This presence signifies recovery, immunity, and non-infectivity. These are the only marker of hepatitis B vaccination. So, anti-HBs marker is the only marker of hepatitis B vaccination. So, once again, we'll repeat. So, we are going to discuss the surface markers of hepatitis B infection. So during laboratory diagnosis, we are detecting hepatitis B antigen and antibodies. These can be detected by sensitive and specific tests like ELISA and RIA. The lab diagnosis includes the detection of viral marker. The first antigen marker or the first viral marker is HBs antigen, which is the first marker to be elevated following infection. This is used as an epidemiological marker of hepatitis B infection. Next antigen marker is hepatitis B precore antigen, HBe antigen. This marker shows active viral replication, high viral infectivity, and these are shown in cases of acute active hepatitis and chronic active hepatitis. Next antigen marker is hepatitis B core antigen, HBc antigen, which is not demonstrable in circulation since enclosed within coat of hepatitis B surface antigen. Next, we had discussed the antibody markers. First antibody marker discussed is anti-HBc IgM. Anti-HBc IgM appears in a serum or in a week or two after the appearance of HBs antigen. Their presence indicate acute hepatitis B infection. These are the earliest antibody marker to be seen in blood. Next is anti-HBc IgG. It appears in late acute stage, remains positive during chronic stage, carrier state, and recovery state. These are used as an epidemiological marker of hepatitis B infection. Next antibody marker is anti-HBe, which presence shows diminished viral replication and decreased infectivity. And the last antibody marker is anti-HBs. These are the only marker of hepatitis B vaccination. I think you are clear about it. So next is the chart showing the markers of this hepatitis B viruses. First is HBs antigen. It's the hallmark of active hepatitis B virus infection. During recovery, disappearance or appearance of anti-HBs, that is persist. Next is anti-HBs. Anti-HBs indicates a recovery and immunity. Next marker is HBe antigen, that is hepatitis B virus precore antigen, indicates hepatitis B virus replication or infectivity. So precore mutants still replicate. Next antibody marker is anti-HBe, correlates with lower level of hepatitis B virus DNA and infectivity. Anti-HBc IgM indicates acute infection, and anti-HBc IgG persists in recovery and chronic HBV infection. Next is hepatitis B virus DNA. This measures disease activity and is used for monitoring. So during acute state, HBs antigen is present or absent. Then IgM antibody is present. E antigen is present and DNA is present. During chronic active, S antigen is present, IgG antibody is present, E antigen is present or absent, DNA is present. During inactive carrier state, HBs antigen is present, IgG antibody is present, DNA is present or absent. During recovery state, HBs antibody is present, IgG antibody is present. During vaccinated state, HBs antibody or anti-HBs is present, which is the marker of hepatitis B virus vaccination. So this is all about hepatitis B virus surface markers. So we had discussed what is hepatitis virus, what are the types, that hepatitis B virus, their morphology, viral antigens, pathogenesis, then lab diagnosis. In lab diagnosis, we had discussed the biomarkers and their detection and what their presence indicates. Okay, so this is all about hepatitis B surface markers. Hope you all understood. Thank you.